In this video, we are going to learn regarding the dissolution study requirements and the bioequivalence study requirement for the extended release oral tablets. The video will be for the extended release formulations, which may be tablets, capsules, or other formulations. The formulations may be having the extended release profile, sustained release profile you can say, or prolonged release profile you can consider. For the generic formulations, the demonstration of the dissolution similarity and bioequivalence is must, and many of the regulatory authorities provide the requirements and the quality parameters for the extended release or modified release type of formulations. You can consider the formulation as modified release. Modified release formulation may be with the extended release, sustained release, prolonged release, or these may have the enteric coatings. So the formulation may vary. You can consider the modified release formulations, but specifically this video is for the sustained release type of formulations, extended release type of formulations, which may be tablets or capsules. So dissolution requirements are there and bioequivalence requirements are there. This information you can get from many of the guidelines, and also you can get this information from the product specific guidances. These guidances are provided by the authorities like FDA and the EMA. For modified release type of formulations, there is no biowaiver applicable or biowaiver is not granted. In vivo, bioequivalence studies are to be done. So mainly fasting and fed studies are performed for the extended release type of formulations. Many of the times the multi-dose studies may be required. Multi-dose studies are also called as steady state studies, and these are based on the product category and the requirement. Generally, the design is single dose for fasting and fed study if it is not a multi-dose study. Single dose study, 2 treatment, 2 period crossover study is generally required, and the subjects may be healthy population, male and females, non-pregnant females, or these may be the patients. If the product or API is toxic or drug substance is coming into the toxic category like cytotoxics materials, anti-cancer formulations, then patients are enrolled if there are any safety concerns for the healthy volunteers. Analytes for the PK evaluation, mainly the parent compound or active compound is measured, and the applicant is required to submit the data for the AUC, Cmax, and sometimes Tmax and other secondary PK parameters. The bioequivalence is based on the 90% CI for all the analytes. Generally, 80 to 125% for the CI is required. Additional strength may be given a biowaiver based on the composition and dissolution similarity. So waiver is possible if it is based on the FDA's or ANDA's guidance, EMA guidances for lower strength or other strength based on the bioequivalence of the BE strength or higher strength, composition similarity, and the dissolution similarity. Then along with the bioequivalence, the dissolution testing is required for the extended release type of formulations. So for modified release, extended release, sustained release, or prolonged release type of formulations, the discriminatory method is required. Dissolution method should be such that it is discriminatory in nature. The dissolution method should have discriminatory power. Options are given like use the official method from USP, BP, or other pharmacopoeia depending on to the market or country specific requirement, and need to show the discriminatory power. Although you are using the USP method or pharmacopoeia method, but still discrimination is required to be demonstrated. Otherwise, if there is no monograph, develop a new validated method and demonstrate the discriminatory power. Generally, the method should be discriminatory considering the critical material attributes, critical process parameters, and the stability. Dissolution testing is required to be done on 12 units for each of the strength of the test and reference. So it is not like that only test is required to be analyzed, but reference formulation is to be tested on 12 units. In the multimedia, you might be knowing the multimedia dissolution. I have made a separate video on multimedia dissolution. You can go through that video. Use apparatus 1 or apparatus 2. Apparatus 1 basket at 100 rpm or apparatus 2 at 50 rpm, and the medium will be pH 1.2, 4.5 and 6.8. Other media also be used if the QC media is other than these three media, or the release media is other than these three media like water or any other media other than the pH 1.2, 4.5 and 6.8. So multimedia dissolution is required. Then dissolution profile requirement is there, as the modified release formulations have the altered release profile. So early time point sampling is must to demonstrate that there is no dose dumping or the dissolution is not faster than the required or not slower than the required. That means the profile is maintained. Early sampling at 1, 2 and 4 hours. This is for your understanding. I am providing the example like 1 to 4 hours. You may consider 0.5 hour, 1 hour, 1.5 hour, 2, 3 hour and 4 hour. So depending on to the product dissolution, you can consider the early sampling time points. Then every 2 hours until the dissolution reaches 80%. Small surfactant can be added, small amount of surfactant can be used considering the sink conditions, and dissolution profile is required for all the strengths. Then the RLD is required to be tested. All the strength of the test formulation and all the strengths of the reference formulation are required to be tested for the dissolution. Purpose of this dissolution profile testing is to ensure there is no dose dumping, and also that the requirement that the dissolution profile is maintained. That means the dissolution profile is modified or the profile is maintained. Then alcohol dose dumping risk is to be evaluated, and the modified release type of formulations or extended release type of formulations are tested in the dissolution media containing alcohol, because alcohol may dissolve the API or it may dissolve the polymer and it may hamper the release profile, and because of that there may be toxicity or there may be loss of the effect of the drug. So alcohol dose dumping is to be done. Alcohol is used like ethanol. Ethanol is used as a alcohol. Ethanol sensitivity studies are required for the modified release type of formulations, mainly sustained release, extended release, prolonged release. Conduct the dissolution testing with alcoholic media and compare with the media without alcohol. So 0% alcohol, 5% alcohol in the media, 20% alcohol in the media and 40% alcohol in the media. I have made separate video on alcohol dose dumping, so you can watch that video to have more understanding about this alcohol dose dumping dissolution studies. Test method: USP apparatus 1 basket at 100 rpm can be used, or USP apparatus 2 at 50 rpm can be used. Medium will be 900 ml of 0.1 normal HCl, and the other medias will be with the alcoholic concentration or ethanol concentration, you can say, as 5%, 20%, 40%. For Europe, as per the EMA guideline, alcohol concentration may vary like 10%, 20% or other as required by the authorities. So in this media, dissolution testing is to be performed for every 15 minutes there will be sampling for 2 hours. 12 unit data is required. And as per EMA, the profile is to be tested in the alcoholic media. Then the dissolution is evaluated considering the media with 0% alcohol to check whether there is increase or decrease in the dissolution because of the alcohol. Dissolution data submission. Submit the data for the test and reference. Individual unit data is required to be given along with the mean, range and percent CV. Clear comparison for each alcohol concentration is to be given. So these are the requirements for the modified release type of formulations like sustained release, prolonged release and extended release. First is bioequivalence. In fasting and fed or multi-dose studies are required, or you can say like steady state study is required. Then dissolution study in multimedia and dissolution study in the alcoholic media. So these are the key points. B studies are required under fasted and fed as per the strength recommended by the regulatory authority. You can get the bioequivalence for lower strengths, monitor the active metabolite, show the dissolution robustness, that means discriminatory nature of the dissolution is to be provided, show the multimedia dissolution, and alcohol interaction is critical for this type of formulations. Waivers are possible for lower strengths. Sometimes, depending on to the composition and dissolution, lower strength can be tested or required to be tested in the bioequivalence. So based on the requirements, the bioequivalence and dissolution studies are required for the extended release type of formulations. If you have any query, you can mail me or you can comment and I will try to answer. Thank you for watching the video.